I'm Dr. Kris Urbaniak. I'm an obstetrician gynecologist working here at the Sun Hospital. Let me just say a few words about a subject that sometimes brings really uncertainty and hesitation and disconcert to the expecting mother's mind. That's episiotomy. Okay, so just to start, we don't do episiotomies routinely. Okay. Now, episiotomy, now that's development. Episiotomy is making an incision, small incision, on to one of the sides of the perineum, vagina. That is to enlarge the opening, and it usually facilitates delivery of the baby's head and prevents tearing towards the back passage. Now, that's a subject that is unfortunately not easy to talk about, but it is very important. We don't do episiotomies routinely because if it does not look like big tear is possible, then a small tear is less painful and easier to repair. Okay. But if there is an operative delivery and if it looks like the skin is really stretching and going to rupture massively, then episiotomy saves that area of the body, of the woman's body. What to do to prevent it happening? Well, actually, there is a way. Massaging and relaxation techniques, they work. But also there is a special contraption that has been invented, that was invented in Germany. It's called Episiotomy. So it looks like a small sort of blood pressure cuff in which you've got a manometer and a rubber bulb that goes inside the vagina. So the woman pumps a little bit of air in the bulb, okay, and then exerts the muscle, looking at the manometer how much pressure she's generating. Okay, and so it does two opposite actions. One, the muscles on the pelvic floor, they get stronger. But the opposite effect, surprisingly, is that they stretch better in labor. And so the private parts of a woman who never gave birth are behaving in labor like a woman who actually gave birth already. They stretch much better. And so it's less risk of having to cut. Obviously, there is yet another way, and I'm saying that with a tongue in the cheek a bit. That's a cesarean, okay? But that's above this discussion. It borders on patient's choice and freedom to make decisions about her baby and her body. If an episiotomy is necessary, that's certainly nothing to worry about. In experienced hands, performing episiotomy and repairing it is usually straightforward. We use high quality materials, non-irritating, and most of the time it's possible to repair episiotomy with a subcuticular stitch. So there is no stitching on the outside most of the time, and so the cosmetic effect should be really good. First and second day after labor, it's usually a little bit of discomfort, which is treated with analgesics, but properly repaired episiotomy heals within about 2 weeks. Yeah, so that recovery is nothing to be feared.